to present Dr. Young. She is going to talk on concussions, and there's probably a few people who don't know you, so you might want to give a little history.
Okay.
All right, thanks. If you want to clip this, you can clip it on. So just clip on this. Can you hear me? Can everybody hear me in the back too? Perfect. My name is Sally Young. I've actually been practicing about 20 years now. So it doesn't, residency at Hopkins, came to U of M, worked about 4 years there as a attending physician. Then went into group practice over at Grand Blanc at Genesis for a few years, and then started my own private practice about 10 years ago, and then started at Chelsea in September for part-time work here. So basically, most of my outpatient has been more necks and backs. My inpatient has been strokes, spinal cord injuries, as well as head injuries. So more of my patients now are the head injury patients, more of the concussion patients. And why I'm also interested in it is I have 2 boys who are 14 and 10 years old. So as you know, and a husband who has 2 other brothers. So there's a lot of testosterone in my house. So there's a lot of concussions in many ways. But my boys also play lacrosse. So why I got very involved in this is as a sport, the U.S. lacrosse, and this is my spiel on lacrosse. I love this game too, so just bear with me. They actually, because in the Midwest, it's not been as popular as on the East Coast where my husband's from. They're actually very proactive about the concussion issues with kids, especially. And these kids now are starting pretty young at travel lacrosse, travel soccer, multiple sports. And as we know, the concussion aspect of it, that has been poo-pooed in a long time. Now this has become much more important and forefront. And I'm one of these crazy lax mom on the sideline screaming, "You can't hit my kid on the head." And that's the reason why I really got involved, because as a group, the U.S. Lacrosse has been really good about trying to prevent head injuries. So a lot of the changes that have occurred, I support, and also because I am on the sidelines, I do know the coaches who are coaching my boys. They do ask. And so I think it's important to start off when they're young, because this is their heads till they're 80, 90. We don't have a replacement for that at this point in time. So, and it is very different mentality, I guess, to deal with coaches, because they're mostly are guys. Sorry, guys, but they do have that mentality. They want to play the game. Both want to play the game. And boys are the same way. So telling them that they have a concussion can be nebulous a lot of times. The symptoms can be nebulous. And that's kind of what I wanted to go over. So this is more kind of kids as well as adults, but it does tend to be more sports oriented that I'm going to relay. But a lot of this also can be relayed with our older folks or geriatric folks and the concussions they have when they fall. Do I just click, or how do I?
You can either use the arrows or you can click the left mouse button.
Okay. So basically I'm going to go over definition, the pathophysiology, symptoms, diagnosis, treatment, long-term effects, and possible prevention. At any time, if you want to stop me, that's fine. I'll try to answer the questions as much as I possibly can. But the definitions for a concussion is really, it is a transient neurologic impairment resulting from an impact to the head or body with no detectable structural injury or standard neuroimaging studies. So basically, it's the symptoms. And I'll go closer to that. There's nothing on CT scan or MRI scan, which makes it difficult to diagnose. And again, when you're talking with kids, there are times when the kids are moaning and groaning because they either don't want to play, or so it's very hard sometimes to depict do they really have symptoms, or are they trying? Is there a secondary gain for them not playing? The stats are, these might be a little bit old. Mostly, I obtain most of my information from the physical medicine rehab clinics. Right now, what they're saying is there's 1.6 to 3.8 million sports recreation-related traumatic brain injuries that occur per year. And the majority are concussions who are not seen at the hospital or in the emergency branch. And the leading causes of concussions in the air that are seen are falls, motor vehicle accidents, unintentionally struck by or against an object. Just to explain this, again, I have boys at the house. They seem to bump into walls or things seem to pop up and they crash into it. I have no idea why, but that seems to be, happens a lot with my kids. Assaults and then sports. Ages at higher risk are between the ages of 0 to 24 years, with the peak occurring in middle school years and adult, young adulthood. So, and then again at 75. Concussions, usually the pathophysiology is a dysfunction of the brain metabolism rather than just structural injury or damage. So basically what they think is happening, and it's seen on animal studies, is that the trauma occurs, the neuronal cell membranes and the axons stretch, and then this causes a release of potassium and glutamate, which causes calcium to flow into the cells. And when this happens, the mitochondria then decreases its functional ability. Okay? And so all of this is happening on a microscopic level, so that's why we cannot see this on CT scan or MRI scan. Even some of the PET scans, we can't quite find that, which is the hardest thing to, again, to diagnose, to figure out what's going on. Also what they're finding is there's a decrease in the blood flow that's occurring at that time. Again, not enough for us to see this on any of our scans. So in animal studies, what they found was it takes about 7 to 10 days for this to then go back to normal. Right? In humans, what they're finding, it could take almost 4 weeks. And so the big deal, and that's why I want to deal with the coaches, is not to return these kids into play, okay? Because if we don't give them the time to heal, the process becomes even more delayed. So the second concussion, this occurs within the first week or so, then the process is even longer than what we think, 7 to 10 days or 4 weeks. It might be double that amount of time. So those kids are then out of play for the rest of the season. And so, like as I stated, so that when we delay these processes, we also develop the late effects, the post-concussive syndromes. So these are all things that we want to prevent. We want the kids to return back to doing their sports. We want, grandma to also return back to doing the things that she does also. So if we don't, if we're not aware of this, if we return the kids back into play within, the time of the game, if there are any signs or symptoms, they need to not play that initial game where they got injured. And then they need to see either a physician, not just the parents saying, oh yeah, they're fine. But we've had that also during these games too.
I have a question.
Mm-hmm.
Would you expect that recovery time to increase in the geriatric population or not necessarily?
They're not really showing that necessarily. It's really the time that what we're finding, which is the hardest thing I think for everybody treatment-wise, is not to really do anything. Okay, which we're all into throwing them medication, getting them into therapy, getting them all exercise, whatever. We're actually finding when we even do minimal exercises or stimulation, and stimulation, this day and age with these things, with the tablets, that actually is delaying the healing process. So trying to get your kid not to play on the tablet because they're taking a break, they're finding that's the hardest part too. Because they're supposed to rest, and rest means their brains, because that's the part that's being injured. So that's the hardest part of the treatment process initially. They're bored out of their minds. They want to get back started. If you're not allowing them to use the tablets or even watch TV, again, that's stimulation, that's processing visually. That is using your brain to activate. So it is very hard to find something that's.
Are they going back to school though?
That's the other thing. Yeah, initially that's the part that, you've got parents who are yelling, you've got school teachers who are also yelling that they want their kids to go back to school. You are supposed to give them a break from school too. I know. So that is some of the issues, and I'll get to the diagnosis. So that's the hardest part. But initially, the symptoms, they fall into physical, cognitive, emotional, and sleep. If they have any of these symptoms, they are not supposed to restart any physical or cognitive activities, okay? So these symptoms physically mean headaches, nausea and vomiting, balance problems, dizziness, visual problems, fatigue, any sensitivity to noise or light, numbness, places of numbness or tingling, dazed or stunned or complaints of feeling foggy. Cognitive issues are feeling mentally foggy, so they're doing something simple and they just can't process it, be it like warming something up in the microwave or something like that. They feel slowed down when they're thinking and trying to do a problem. Difficulty concentrating, difficulty remembering, forgetful recent information or conversation, so you just talk to them about doing something and then they can't remember to do it. My house, I might not need anything. So, confused about recent events or confused about what happened after the injury, and repeats questions all the time, trying to get that information. And then emotional is irritability, sadness, lability, nervousness, something that's different than what their normal personality would be. And then sleep is a big problem. So they're drowsy during the day, they're not sleeping as much at night, or they're sleeping more. So it could be one or the opposite, or they have trouble falling asleep. So they have a hard time doing that. So any of all those symptoms, I know there are a huge amount of symptoms, they're not supposed to return back to play or cognitive, and that includes school. So some of the things that, for diagnosis, is the standard assessment of concussion, which you should have a copy of. And this is something that can be done on the field, and it's quick. It should only take maybe 5 minutes or so. Ideally, what they're saying is we should be doing this for all our athletes in the beginning. Yeah, if you're looking at the one on the, it was difficult for me to read, so that's why I asked if we could copy that.
It's the last page in your packets. You should have it here.
So this is a quick test. Anybody can give this test. You're supposed to get a perfect score on it because it's not that difficult of a test. Ideally, what they're suggesting is that we do this before any child starts sports or activity. Being that my husband's coaching 29 kids, good luck to him on trying to do this, even though it takes 5 minutes. But ideally, they should have a baseline. So what we're looking at is having a baseline, and if something should happen on field, you can easily do this test in 5 minutes. If there is a drop in 1 point, that's enough to say that they have a concussion, they're out of the game, and then they need to be evaluated by a physician in regards to that. Again, you're going to have, everybody is going to have to deal with somebody who's going to complain about that. My thinking and what I usually tell parents is, you know what, if I'm wrong, nothing happens. The kid goes back and plays, he might miss a few games. If you're wrong, something could possibly happen. So this is your child. So err on the side of conservative. And I've had patients, I've had parents who are really upset. But I'd rather they miss a few games and I'm wrong than they seriously get hurt later on. And we've had, I've talked to the women's pioneer coach, and the athletic trainer said they were fine because the parents were saying blah, blah, blah. They went into, later on, the child still had headaches and everything, went in and she had a bleed. So you want to prevent that. I mean, deal with whoever's going to bitch and moan at you, but the bottom line is the child or the patient's issue, they're gonna have to live with this forever. So if you're wrong, it's okay, nothing happens. If they're wrong, something could possibly happen. So that's usually what I go at tell them. And that usually shuts them up, and we can keep moving on and doing what we need to do. So like I said, this only takes 5 minutes to do, even in your office if you want to, if you're doing some serial checking on the patient, it doesn't take long at all.
Dr. Newman,
Mhm.
could you speak about the 0 and 1 under the trial 1, trial 2? When are the trials? Do you have a trial and then a delay and then another trial?
Basically what you do is you pick one of those forms, so it says A, B, or C, or D form. Okay, and so you pick any one of those, all right? So you usually go through one trial, you wait a few minutes, and then you do the second trial. So what you want to do is that they keep either adding numbers to it, the letters to it, or I'm sorry, the words. As long as they're making progress to that, that's what you want to see. So the memory is starting to kick in. So it is repetitive in that sense when you're doing the trials for the first time, and some of it will be kicking in as memory or as repetitiveness. That's okay because you want to see that improvement. Yeah, but you just wait a minute or so, and then you do the trial, the second trial. Again, this is all on you want them to improve with each trial when you're doing that.
Excuse me,
Mhm.
so do you give the whole list again? Or
Yeah.
do you?
You pick the same list, so you just pick one of those forms.
Right.
And it's, yep, the same 5,
And then you repeat it again in a few minutes?
yep, yep. And so what you want to do is see at least an improvement. So if they start out with 0, you want at least them to pick out one of those words out of there. So yeah, it is an improvement. You want to see some memory kicking in, hopefully, some short-term memory. Any other questions with this one? And then on physical, one of them is the balance test, which is basically the one with the kind of stance. Again, you can do this on field. The hallmark of concussion is actually when they close their eyes, when they all of a sudden lose the balance. So they're using other senses, not just their proprioception, they're using everything to stay balanced. And when you see that, then it's more likely that they have a concussion that's occurring. And if they're on the field and the initial SAC assessment test is completely normal, what you kind of do is then induce the exercises. So you make them do like jumping jacks, repeat it again, and if they drop, then you know that it will be exercise induced. So if you send this player back out onto the field, he's going to have some issues or she's going to have some issues. So if the SAC is normal when you first do that, that's fine. Repeat it by making them do something like jumping jacks, push-ups, something, just 5 of them, just to exert them and see what happens. If they drop in their points, then they need to stay off the field. And they need to be reevaluated. Again, sometimes it's hard to do on the sidelines with a whole bunch of kids screaming, but it's important to do it, or at least pull them off. Again, decide on more conservative. It's just more important to getting them off the field and evaluate them someplace else if you need to. And the acute concussion evaluation, which is also on your handout, it's by the CDC, and it's called the Heads Up pamphlet, which you actually can easily get on the CDC website. It's actually a good, compact information on head injury. Easy read, easy to show to parents also. Their assessment is obviously much more conclusive than the standard assessment test, but that's more to be done at the sidelines and on your in your office as a serial sort of information. And it goes over again the symptoms. Can they recall when the accident occurred? Do they remember things afterwards? You know, risk factors. Do they have a headache history, all of that. So this is a little more detailed. And then again, the imaging and CT and MRI, as I stated, it really doesn't tell us whether a patient has concussions or not. What you really want to rule out is anything serious like a bleed, subdural hematoma. Those are there to rule out that. It's not to tell us whether they have a concussion or not. And sometimes it can occur later. We might see it later on. So if the patient has any symptoms afterwards, even though you think it was a mild concussion or it was just a, whack on the head with a stick or whatever, if the symptoms persist, there's got to be something else going on. It could just be the concussions with all the symptoms itself, but you want to make sure that it's nothing serious. So if you see something that's different from your child or, your child's friend or the patient from, one therapy session to the other, then that just needs to be evaluated. And especially in our older patients, because there's other issues of vascular problems, high blood pressure, emboli, we might not see that initially. Subdural hematoma, again, had patients that have fallen, the initial CT scan in the emergency room, nothing going on. She's just not quite right. 2 days later, we do another scan, and there's bleed in there. So we do have to be aware of that. It can occur later on. And also what they're finding in, later on in some of the MRI scans is the prefrontal cortex, which is equivalent to some of our depressed patients. We're also seeing that in some of our depressed patients. So when there's symptoms of depression, that also might be, we might see that in the MRI scan, which would also be some of the problems, and again, more of the post-concussive symptoms that we see in some of the patients later on that you think should have resolved by now. And then the biggest, and actually I think the most accurate, is the neuropsychological testing. Unfortunately, it's one of the longest testing. It takes most of, there is also a push to do this prior to each athlete playing the sport. Again, good luck to you, I'm trying to do this, okay? As we all know, it takes hours, unfortunately, to do this. Now, and then so the question is, and especially in our younger players, obviously the brain is developing, this is going to constantly be changing as it is. So in an ideal world, we would love to do the neuropsych testing on every single one of our athletes. And as they're young, do it every 1 to 2 years to get a baseline. This isn't going to happen. So it is the most sensitive for the concussion symptoms and for those patients that we have that are harder for us to figure out what's going on. But it is a long test. It's an expensive test. And frankly, most patients don't even want to do this. So, but ideally, that's what we should be doing. We should have all our kids do this. We should be retesting them every year or two so that we have a baseline in case something should happen. But it isn't going to happen. So there is a quick method that they have, and I'm not sure that the professionals do it. They might, where they do a computer-based type of testing that's easier and shorter to do.
They are doing that in junior hockey programs
Oh,
now.
they-
My son played in Muskegon and they tested them all preseason, and anyone that had a concussion during the season had to get back to their baseline before they could return.
So did that work? I mean, was that something that families were, or did they have to sign and say they had to do it?
I, as his parent, did not sign. We had to do it to play
Okay.
on the team, and it was part of the program. And I know some kids that had concussions that they kept out of school and sports for a long time. So some of the sports, I think, some of the teams, I think some of it's owner dependent.
Yeah.
You know, too.
Yeah, I mean, again, just getting more involved because of my boys being more involved. The travel teams are very different, so, and I know that the school system can't afford to do this at this point in time, so, but yeah, each travel team seems to be different. And it'd be nice to be able to do that, but I know I'm not hearing that at this point in time, because it is time consuming. And again, if you've got 30 kids on a team, that's only one team we're talking here, so, yeah. And that's great. I'm
Hopefully
glad.
they'll get some data too.
Yeah.
From some of that information.
But they do say that the computer based is easier, but the problems that they feel with the computer based is you're missing some of the human elements that, you know, a trained neuropsychologist would know what to pick, so that you lose some of that. They lose, they're not able to, on the computer, do the auditory processing or the verbal memory, that type of stuff, or even just seeing the behavior that the patient has. So, and that's kind of all included when you get a neuropsychologist kind of involved in that. So they're doing the computer-based.
Computer based,
No, like I said, I would love it if they could do that, and it'd be easier. It'd also be easier for me to tell them, you know, they're doing worse, so there's something going on.
It's hard to talk to parents.
Yep, it is, and especially when you're talking about a travel group. These are supposed to be more elite players, so, you know, they're all kind of putting their eggs in one basket kind of a thing. Either getting their kids a scholarship so they can get to college. There's so many other issues that are involved, so yeah, it's very hard to be able to convince them that this is the right thing to do it. And same with the coaches, because the coaches want a winning team. They want, you know, so that more players come and work with their program. But if these kids have concussions, then you have issues. So you're fighting back and forth with parents as well as coaches, frankly, and program directors of these travel teams. And sometimes even the high school teams are the same too. So, so treatment. No activity on the day of injury, so whatever happened, they stop. They're up for beating, okay? Don't care who yells, don't care who's screaming at them. They're out, okay? And no physical or cognitive activity until all the symptoms resolve. So they're not supposed to go back to school. They're not supposed to do an activity. And as I said, the hardest thing is the tech, all the tech that we have. They're not supposed to do that either. So, yeah. Usually I told parents, grab it, throw it in someplace, lock it in a drawer. They can't text their friends, they can't, you know. They can actually use the old landline and call them on the phone. So I have a feeling, I don't know if my kids know how to use that anymore. But, yeah, so they can do something simple like that, but they cannot use the texting on the phone or their tablets. And then what they describe is a gradual return to school, sports, and work. So the first day of the injury, no play. No physical or cognitive activity until all symptoms are resolved. About 7 to 10 days is for a mild TBI. Then what they suggest is light aerobic exercises to increase heart rate to about less than 70%. No resistive training, so no weights or anything like that. Then sports-specific exercises with no head impact kind of drills. So it is lacrosse, just tossing the ball back and forth. You know, doing side-to-side type of motions, running, things like that, and adding more movements to it, okay? Then the next level is non-contact training drills. They can do more resistive exercises, things like that. And then increase also their cognitive load so they can start to go back to school and do things like that. And then the next step is a full contact practice once they're all other medically stable, and then go back into the game, the next step. Each of these steps 24 hours supposedly. So if they can accomplish these within 24 hours, you can move on to the next step. If they cannot, you go back down to the next level and you work on them until they can accomplish that symptom-free for 24 hours. So it might take longer. It depends. Ideally, they should be able to go back into their full sport if they do have it within a week or two. Again, I know that there will be a lot of screaming parents and coaches, but it is the safest. So normally we have kids return back within about 2 weeks. And then so what we want to prevent by doing this is the post-concussive syndromes. So those again are in 4 basic categories. So it's the somatic, the headaches, the nausea, the photophobia, the vision changes, sleep disturbance, balance deficits, and then the emotional aspect of irritability, apathy, depression, anxiety, and then cognitive slow processing, speech, attention deficits, impaired cognition, poor performance on the neuropsych testing. All of those symptoms, usually we call it post-concussive about 3 months after the injury occurs. So if all these symptoms still continue to persist, they're then called post-concussive symptoms. And the treatments basically are for speech language pathology, the neuropsych, and if for balance and issues, there's PT and OT also, but most of it is speech and the neuropsych testing. There is not a lot of medications for this, unless they complain of headaches. We don't have anything that seems to stimulate. We've done some with the TBI, more severe TBI patients, but not with our concussive type patients. I just haven't found that it works unless I'm dealing more with pain like headaches or neck pain. Otherwise, there isn't something that seems to stimulate cognition. They've tried. There seems to be more side effects than there are benefits to these medications. So those are basically what we're looking at on the post-concussive. Then what we're also finding, or what we're thinking is happening, and we probably heard it with the football player from Hawaii, are the degenerative diseases like Alzheimer's, Parkinson's, and CTE. CTE can only be diagnosed post-mortem. Okay? So that's the problem with that one. So it is, the symptoms are similar to Alzheimer's, but what happens is their survival rate actually is longer. It starts out milder and seems to progressively, in the next 18 to 20 years is when they, so that's why it's also difficult to diagnose in these patients. And again, we have no way of diagnosing it prior to their deaths, so it's postmortem. And again, with Alzheimer's, we've tried different medications. I've not really seen them work. There's no way for us to reverse it once we find it. Parkinson's, we have Cinemet to slow more of the physical aspects of it. Again, not the cognitive aspects so much. I know we're doing more brain stimulation that has its own side effects to that also. So once we get to this point, it's more palliative care that we're doing.
Could a 40-ish-year-old guy who's played soccer his whole life end up in post-concussive syndrome maybe after one more head bump in a game a few months ago?
Mhm.
And can they stay there for ever? Like the headaches,
Yes.
so-and-so?
Yeah, yeah. It's pretty much diagnosed about 3 months after whatever the last injury or whatever injury you thought occurred. It can last till, yes. Yeah. Yeah. And it can be, also with our motor vehicle accident patients, we get that too.
NBA from the past plus soccer
Yes.
equals.
Yeah. Yeah.
So, with the treatment that you described on the previous slide, if the concussion is diagnosed, like say the soccer player,
Mhm.
it's diagnosed he takes off work, he lays around listening to classical music, or, if he does that recovery correctly, then that will prevent the post-concussive.
Yes, that's the hope, yes.
Okay, that's the
Yeah, the hope, the thought is that we get them, why they get the post-concussive syndrome is we've started them back to their work, their sport, too early, right? And that's why the 7 to 10 days in the animal studies we're showing is, it's all metabolic. And again, that's the problem, we're not very good at the micro type of finding, because it doesn't mean that the potassium levels when we draw blood are elevated or the calcium levels have dropped. It's not that drastic of a change over.
So you're explaining to people, so like if I was explaining to the soccer player, I'm talking about the only way we know this is happening is if you're having symptoms. That's the only way we know. And that if you go back to what you're doing too fast, it's like you're like preventing your brain from recovering.
Yeah, you're not giving it, well, think of it, if you can think of it this way, we wouldn't send somebody back with a broken leg, right?
Yeah.
So, yeah, and that's the hard part, is there's no way to show them a picture on the MRI scan that this is what's happening. We don't even have lab work that we can show them that this level is off. It's all microscopic and it's all so small. It's very hard for, but yeah, to relay it this way, I wouldn't send you back if your femur was broken. Would you think you could go back with a cast on and play soccer? I mean, sometimes you do have to explain it that way, and then that they get it, So yeah, that's the thought, is that if we do these treatment programs, we do it from the get-go, we prevent the post-concussive syndrome. So the big thing is prevention, if we can. So some of the stuff with the kids and their sports, the helmets, I've watched them, the old football players, they didn't wear them in the beginning, then they wear these leather things that I don't understand why. And then, now it's gotten bigger, heavier, and those are important. It has prevented some of the head injuries in more of the contact sports. In the New York Times just recently, in regards to helmets with skiing, I'm not surprised. What they found was the head injuries did not decrease. And what they believed was, it was that people were doing riskier behaviors, which again, I can see my kids doing the same thing. So, they think they're invincible with this helmet on. Unfortunately, the rock doesn't think so, or the tree doesn't think so. So that's the biggest thing is, yes, they have the helmet, is to protect them, but they still need to do the normal type of activities they should be doing. Also with the mouth guards, it's not intuitive to have a mouth guard and think that's going to prevent a concussion, but depending on, again, the sport that you're playing, at least it prevents the jaw from going all the way up and hitting you that way. So it does prevent the impact sort of activity toward your brain. And then what they're suggesting also is decrease the number of impact practices, because they're thinking that practices cause more of the problems. Again, depending on the sport, it's not so much in lacrosse, and I don't think it's so much in hockey. It is more in football, really.
Soccer.
And soccer, soccer, they're changing. Yeah, they're changing also their rules of, which is the next one, of the heading. So they're trying to actually decrease when the kids can head and how much they're allowed to head. So yeah, they are decreasing that amount. Soccer is one of, out of the contact type sports, it's one of the lower ends of head injuries, but it is up at number 4 or 5. So football is the highest, hockey is next, and lacrosse is next, and then soccer is next. In girls, cheerleading is what's found in, yes. And it happens at competitions when they get dropped, is usually the highest. And as I said, the biggest thing to prevent is stand behind the slow return to work.
Is there any research or evidence about doing neck strengthening and things like that as
To
far as?
prevent the
Yeah,
head
I
injury?
know that that's a big push where my son is playing. They're telling them to do this neck strengthening because it's gonna help prevent concussions. I was wondering if there was any research behind that.
There's no research that I know of, and intuitively from my standpoint, that.
Yeah, me too.
Yeah, because it's coming from this end usually versus,
Right.
something here. Maybe it would help with a stinger kind of a thing, but no, I haven't seen any, that might be a coach thing.
Yeah, well, he's seen it at all levels, and I've heard it at the high school level, I've heard it at juniors, I've heard it in college. All levels are doing this neck strengthening. So I was just wondering if there's any research.
No, I haven't seen any research, but I don't really see that. would occur.
I didn't either, but you can't tell boy anything.
Yeah, I know. And these are the references that I tended to use for this talk. But the CDC, I thought I was surprised at how much information was in this pamphlet, as well as they also having a huge bibliography